Hello, and welcome to Breathe In, Breathe Out, Tips for Modern Parents, brought to you by Sanofi, the maker of Beyfortus.Nirsevimab-alip 50 milligram and 100 milligram injection. A preventive antibody that can help protect your baby against serious RSV lung infection. It's for babies under 1, born before or during their first RSV season, and certain kids up to 24 months. Your child should not take Beyfortus if your child has a history of serious allergic reactions to nirsevimab-alip or any of the ingredients in Beyfortus. Stay tuned to hear more important safety information about Beyfortus throughout the podcast. I'm your host, Kimberly Justice. In this series, I'll be talking with parents and healthcare professionals about navigating life with a newborn. Along the way, we hope to create a sense of community and connection so you feel supported throughout your journey to raise a happy, healthy child. Today, we're talking about illness and sleep in year 1. So let's get into it. So as a nurse, I am passionate about helping people get educated about healthcare. And as a mom, I know stressing over the wellness of your newborn, that can be all consuming. So I have some help today to straddle the line and share some tips with you as well. Joining me is Dr. Mona Amin, and she is a board-certified pediatrician, lactation consultant, and a mom. Now, you might just know her simply as Dr. Mona. She is the founder of PedsDocTalk. That's a global platform that offers evidence-based guidance and relatable insights, which, boy, do we need those, on things like child health and development, parenting. She hosts the PedsDocTalk podcast, and you may have seen her on Good Morning America, ABC News, all that. Welcome, Dr. Mona.
Oh, thank you for having me. I'm so happy to be here to chat about this important topic.
Yeah, this is going to be good. And also joining us is Anne. Now, Anne is a full-time working mom, and she's got a 2-year-old daughter at home. She lives in Tampa, Florida. So welcome, Anne.
Hey there. Thanks for having me.
The Breathe In, Breathe Out podcast is sponsored by Sanofi, and all the guests of the podcast are being compensated for their time. Okay, so today we're going to tackle sleep and illness in the first year of your baby's life. These are two huge issues, and it's made much more difficult when they are colliding. So, Dr. Mona, as someone who communicates a lot with parents, how much are new parents talking about illness and sleep?
Oh, well, this is one of the most important conversations I have, especially around sleep, right? When is my baby going to sleep through the night? What can I do to allow those longer stretches, especially in that newborn period and as they approach the rest of their infancy? So already, as you said, sleep is a big source of questions I get in my office. And then maybe your child is getting into a rhythm, maybe they're getting that longer stretch, and then they get sick. So, a majority of the parents of newborns who I see in my practice have questions about sleep. And then, if you add illness onto it, I'm going to get a lot more questions. And this is very common between November and April when germs are circulating, people are indoors more. And so, we're seeing a lot of this collide. And I don't think people talk enough about how to manage the sleep of a sick infant. So, I'm happy we're having this conversation.
Yeah, and it's not just the babies that are losing sleep. So knowing how to communicate the issues that keep us parents up at night, that's important too, especially being able to go to your doctor with concerns. So Anne, how much did you think about that, about babies losing sleep and staying up at night? How much did you think about that when choosing a pediatrician?
Oh man, choosing a pediatrician was such a big component, and sleep was a big part of that as well. I feel like everyone online is constantly talking about infant sleep training, and there's a lot of information out there that can be overwhelming. I knew that choosing a pediatrician that would partner with us was a critical piece. We spent a lot of time at the pediatrician's office when I was a child, so I knew that I needed to find a partner in my pediatrician that would work alongside my husband and I to make sure our child stayed healthy.
Dr. Mona, it's so normal for new parents to stress over how or if their baby is sleeping, whether they're sick or not. So, what kinds of things can parents keep in mind about managing their child's sleep, just in general?
Well, this could be a whole book, and maybe one day I'll write it. But there's so much to say, right? And I love what Anne was saying about finding a partner in their pediatrician, right? Because it is a relationship. You are going to be with this pediatrician for 21 years, and that foundational piece, how to approach sleep, how to approach feeding later in life, it's important to be on the same page. Now, the first thing I'd like to say is that when you're looking at sleep in general, every baby is unique in their sleep because every baby has different temperaments. My son was a very good independent sleeper. I mean, I could put him in a crib, he was completely fine. My daughter took a little bit longer to be able to transfer, to an independent sleep space. And so you could look at it as like, why isn't she going in that space? But I looked at it as she's unique. She has a little more, koala bear needs, which is totally like lovable. How can I approach this baby in front of me when it comes to sleep? So that's like the
Mhm.
first general tips. The most important goal is figuring out how can we get the best sleep stretches for your child for their age, and not trying to meet an ultimate goal of like 12 hours by 12 weeks or anything like that. And I do believe, this is my personal belief, that all kids can and should learn to sleep on their own. What I mean by that is being an independent sleeper. But some may just need a little more
Mhm.
TLC than others, right? Some may need a little bit different strategies. So every child is able to sleep on their own, but the strategy and the approach can differ based on the child's temperament and the family's approach to parenting and sleep strategies.
Yeah, and that's so true for all kinds of parenting. What works for one doesn't work for another. So, Dr. Mona, can you tell me when a kid does get sick and their sleep is disrupted? What's your advice for parents in that case? Because they still need sleep. Everybody needs it.
Oh, I have so many tips, and I've been through this, right? I have, at the time of this recording, a 6-year old and a 2-year old. And listen, they've been through it, right? With illnesses as well. Every child gets sick. So it's very important to remember that if you have a sleep schedule, right? Sometimes by the time the child is maybe, 6 months, you may have a routine, right? Like a resemblance of a schedule. And you can sometimes get hyper fixated on the routine and try to maintain it even when a child is sick. Well, now my kid's sleeping longer. They're not going to sleep through the night, and that's something I really want you to throw out the window. I want you to remember that when they're sick, you got to let them sleep if they're sleeping, because sleep is healing and sleep is regenerative. Obviously, go check on them if you are, wanting to make sure they're okay, but I highly recommend letting them sleep. The only caveat to that is if you feel like you need to get hydration in and you can talk to your child's clinician, you may wake them up to just get some, a breastfeeding session or a formula session in, but it's ideal to let them sleep. And whatever kind of sleeper your child is, when he or she is healthy, they may have more or different needs when they're sick. So, what I
Mhm.
mean by that is you could have an independent sleeper. You could have a kid that goes to sleep without any issue in a bassinet or a crib. But when they're sick, you're going to have to think about what are some strategies, because their needs are going to become higher. Focus on addressing their needs, and then we can reteach any sleep strategies when they're feeling a little bit better, and definitely not when they're febrile or acutely sick.
Sure. And sometimes it's hard to know if your baby's sick. And the worst is when that fear hits you in the middle of the night. We've probably all been there, and you're thinking, well, it's hard to reach the doctor right now, and then you start Googling. So, and how have you navigated those moments as a new parent?
Well, to be totally transparent, I have Googled way more than I should have, and I think you
Right.
will always find what you're looking for when you're trying to Google.
Sure.
But there has been one time where my Googling kind of paid off. My daughter was very young; she was still sleeping in a bassinet in our room, and as a new parent, anytime your child makes a noise, you instantly perk up. You could have been in dead sleep, but you wake right up when you hear that sound. And she was kind of starting to gasp for air, which really freaked me out. I knew something was wrong. So I Googled what I could be doing. And the first thing it told me was like, make sure that she has a pulse, which of course she did. But the next thing it said was record the sound that you're hearing and use that to bring it into your pediatrician. So recorded that sound, watched her like a hawk that whole night. 7 a.m. the next day when the pediatrician's office opened, I called and got her an appointment that day. And our pediatrician grounded me so much. She listened to the sound. She reassured me that I did the right thing by recording it, that I did the right thing by watching her overnight. She validated my fears, which was super helpful because as a new mom, you could very quickly spiral. She reassured me that what I did was the right thing.
Sure.
And then she quickly got us into the ENT, or the ear, nose, and throat doctor, to have her evaluated for a condition called laryngomalacia.
Mhm.
It's not a super common thing to have happen, but it's basically where the baby's throat doesn't grow skin correctly. It usually self corrects, but it can make a really scary sound. So, just having that conversation with my pediatrician, knowing that she trusted that I was a mom and I knew my baby, she took me seriously. We got the problem evaluated, we got a plan in place. And then within a year, the sound was completely gone. There was no structural problem.
Hmm.
She healed fine. She breathes normally overnight now. But it can be very scary when you're up in the middle of the night and you don't know what to do, especially if you can't get right through to your pediatrician.
Absolutely. And Dr. Mona, this is something that I'm really passionate about personally is new parents, like trusting yourself and trusting your gut. And I think that can be hard for some new parents to do. So, can you tell us what are some good rules of thumb for parents to help determine, when is it time to call the doctor or when is it time maybe to go to the ER or urgent care?
This is such a great question. Thank you, Anne, for sharing that story because, again, I think that gut experience is so valid. And a
Yeah.
lot of my moms that come into my office and dads feel like they're either a burden if they think they're overreacting or they think that, what if I don't have that intuition? All I can say is that if you can drown out all that other noise, you can tune into your baby. And the worst case by coming is that we say everything's okay, meaning like, you didn't waste our time. At least we can tell you that. Or I guess the best case, I should say.
Right.
And when it comes to what to take your child in for, of course, there's so many things. And I think I'm going to focus on like the big thing that we see, which is like fever and like upper respiratory infections. If a child is under the age of 3 months and has a fever, you should let your pediatrician know, or you should go to an ER or urgent care to get your baby evaluated. Now, for babies over 3 months of age, difficulty breathing. So, this is something where their nostrils can flare in and out, or they're like above their ribs, they're tugging in and out, or their ribs are tugging in and out. They should go straight to an ER versus calling the doctor because this is a sign of difficulty breathing. The next thing we're looking at is dehydration. So, if they're not drinking, whether that's breast milk or formula, and they're not making wet diapers, let us know. That means your pediatrician, so that we can see if they need to be evaluated and admitted to a hospital for fluid. And then the other things have to do with fever. So, persistent fever. So, I'm not too worried about a 1 day fever in a 4 month old or older. But if it's a persistent fever, meaning over 3 days of fever, get them evaluated. And then also, if any duration of fever and the child is uncomfortable, so you're using acetaminophen or ibuprofen and it's not helping, and the child is inconsolable or listless, I would also want you to get them checked out by your child's clinician.
Dr. Mona, that is terrific advice and help. So thank you for that information. So, and I know you had the issue with your child and the breathing and the concerns there, and obviously Dr. Mona talked a lot about things to look out for. So, did you have familiarity with some of those respiratory illnesses that can go around when your baby was born?
So, before my daughter was born, I really just thought respiratory season was respiratory season. I didn't realize that it could get kind of scary. In the fall before she was born, I saw multiple friends posting on Facebook about their children in the hospital with RSV, which was crazy. I didn't realize that something like that could be so serious. I really wanted to do whatever I could to help protect my child from having to be hospitalized.
So, Dr. Mona, can you tell us a little bit more about RSV and its risks?
Yeah, RSV stands for respiratory syncytial virus, and it's a respiratory virus that starts with symptoms similar to a common cold, runny nose, coughing, maybe a fever. And while most cases are mild, it can get worse and possibly progress to wheezing or a child being very congested with a lot of coughing. And 2 out of 3 babies will get RSV by the age of 1. And severe RSV is uncommon, but it's also a leading cause of hospitalization for babies under 1 year of age.
So, Dr. Mona, let's talk about RSV and the preventive antibody Beyfortus. What would you say is the most common misconception about Beyfortus?
I see this happening from medical professionals when they talk about terminology as well as patients. Beyfortus is an antibody. It's not a vaccine. So it's a little bit of a nuance here. So an antibody neutralizes a virus on contact and it can provide protection more quickly than a vaccine. Whereas a vaccine, you get the vaccine, your body's being forced to make an antibody so that the next time it gets introduced to a illness or that virus, that it can mount a response. So it's like a more rapid defender for this RSV virus than compared to getting a vaccine.
Okay. So, Anne, what were your questions? What did you want to know about when you were looking to get the Beyfortus shot for your baby?
So my number one question was, what are the possible side effects of Beyfortus? And I also wanted to know how many times that she'd need to get it.
Sure. So, Dr. Mona, what do you say to those questions?
Beyfortus is given as one dose to the most vulnerable age group, which is infants under 1 year of age. An additional dose of Beyfortus may be needed for children up to 24 months of age who remain at increased risk for severe RSV disease in their second RSV season. Now, in the particular case of children undergoing cardiac surgery with a cardiopulmonary bypass, an additional dose of Beyfortus is recommended as soon as the child is stable after surgery. Beyfortus may not protect all children. Regarding safety, while serious allergic reactions have happened, the most common side effects are rash and pain or swelling or hardness at the site of your child's injection.
And what did you decide? Did your baby end up getting Beyfortus?
She did. It really came down to me trusting my pediatrician and really building on that partnership that we had already built. She's the expert. I'm not. So we did discuss that serious allergic reactions can happen and there are possible side effects of Beyfortus. We also discussed the serious lung infection that infants can get from RSV. It was kind of a no-brainer to me.
You know, I recommend all parents of infants talk to their pediatrician about RSV and Beyfortus. I think what Anne had added is really important, that this antibody can really help reduce the chances of severe lower respiratory tract infection. What that means is that your baby could still get RSV, but the chances of having the pneumonias, the bronchiolitis, the hospitalizations has been shown to be much reduced. And that is why we love it.
All right. Well, Anne, thank you so much. Dr. Mona, thank you so much for joining us today. I think this has been a really helpful conversation. I think it's going to help a lot of parents. So thank you both for joining me today.
Thanks so much for having me. I really enjoyed this conversation, and I think this information is super important.
Thank you as well. I think it's so important that parents feel more confident in the choices that they make, and I think this episode really did that. So I hope it resonated with so many of your listeners today.
And of course, you can find Dr. Mona on Instagram, and that's at PedsDocTalk. To hear all the episodes of Breathe In, Breathe Out, go to the Beyfortus website. That's Beyfortus. I'm Kimberly Justice. Stay tuned for full important safety information. Important safety information. Your child should not take Beyfortus if your child has a history of serious allergic reactions to nirsevimab-alip or any of the ingredients in Beyfortus. Before your child receives Beyfortus, tell your healthcare provider about all of your child's medical conditions, including if your child has ever had a reaction to Beyfortus. Has bleeding or bruising problems. If your child has a problem with bleeding or bruises easily, an injection could cause a problem. Tell your healthcare provider about all of the medicines your child takes, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Your infant should not receive a medicine called palivizumab if they have already received Beyfortus in the same RSV season. Serious allergic reactions have happened with Beyfortus. Get medical help right away if your child has any of the following signs or symptoms of a serious allergic reaction: swelling of the face, mouth, or tongue, difficulty swallowing or breathing, unresponsiveness, bluish color of skin, lips, or under fingernails, muscle weakness, severe rash, hives, or itching. The most common side effects of Beyfortus include rash and pain, swelling or hardness at the site of your child's injection. These are not all the possible side effects of Beyfortus. Call your healthcare provider if you have questions about side effects. Indication: Beyfortus is a prescription medicine used to help prevent a serious lung disease caused by respiratory syncytial virus, RSV, in newborns and babies under 1 year of age born during or entering their first RSV season. Children up to 24 months of age who remain at risk of severe RSV disease through their second RSV season. Please see accompanying links for full prescribing information, including patient information.